Anxiety exists in some form, all the way from small one-celled creatures all the way back to the beginning of humankind. That tells us what a fundamental and an important emotion it is. Anxiety, particularly fear, can be life-saving. When we face a threat to our lives, let's say like a tiger in the jungle, we form what's called a fight or flight mode. Our muscles surge, our blood pumps, energy goes out throughout our body, and we act and we think quickly to save our lives. We run or we fight. Sometimes, however, after the threat passes and we've survived, the fight or flight mode continues. And at that point, it's no longer functional and it creates a great burden, a great source of stress for us. That can often be known as something called post-traumatic stress disorder, or PTSD. That's fight or flight mode that keeps on going even when we don't need it. If you've been in a life-threatening situation, it may be the pandemic, maybe it was a car accident, an assault, or otherwise, and you think that you might have PTSD, there are a few questions you can ask yourself to try to help you figure it out. First and foremost, does the traumatic experience linger for you on a day-to-day basis, filling your mind, affecting your behavior, even though it's long since passed? If your answer to that is yes, or you're not sure, you can ask yourself a few more questions about the specific types of symptoms that make up PTSD. First, do you have ongoing thoughts, nightmares, dreams, even flashbacks about the event that don't leave you alone? Two, do you spend a lot of time avoiding reminders of the traumatic event, thoughts or places, and it takes a lot of energy and even distracts you to engage in that level of avoidance, gets in the way of your life? Three, have you become overly negative about yourself, about the world, about the people around you in a way that you never were before? Or four, are you what we call hypervigilant? Are you acting like you're on sentry duty all the time, looking for another threat in ways that maybe spill into your sleep, disrupt your focus and your concentration in your waking life? If you think you have PTSD, there are a lot of resources to help you. First and foremost, those within you. We've developed a lot of coping resources and are generally quite resilient as people, resilience that many of us demonstrated so far in the course of the pandemic, and those internal coping resources can help you deal with the PTSD. Second, of course, there's the people around you. Your family, your friends, maybe your clergy, maybe your coworkers. Turning to support from others is a fantastic and important and natural way to deal with getting through a trauma. But in truth, if you think you have PTSD, you probably need professional help to get you all the way through it. Here at Mount Sinai, we have a number of resources that can help you with that. There's the Employee Assistance Program. There's the Department of Psychiatry, which has its faculty practice as well as outpatient clinics. And most recently, we've started the Center for Stress, Resilience, and Personal Growth, a center devoted specifically to addressing the COVID-19 related mental health needs and psychosocial well-being of our staff, faculty, and students. If you think you have PTSD, don't go it alone. Come get help. Thank you.